Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. So if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love to share the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. All right. I take all of the questions that are posted onto viewer comments, to Instagram, to emails, and I put it all into one episode. So here we go. And thank you to everybody who submitted a very good set of questions. All right. First question. I am in the process right now of highlighting and writing little notes in my ICD-10 CM codebook guidelines. I feel like I'm moving so slow in my coursework and it's giving me anxiety. Any ideas of notes that will help me to write in my code book would be very appreciated. All right, when it comes to writing in your code book, anything, writing, highlighting, and things like that, I recommend to do this very sparingly. The book already has all the answers. It doesn't need extra things from you, right? Because if you know how to use the book, you're going to know how to find the answers. Now, a lot of people neglect the appendixes that are in the back of the book. Okay, they're just looking in the front of the book and they're looking at the guidelines, maybe, and they're looking at the index and the tabular section, but they're not really paying attention to the appendixes. Guys, explore those appendixes. Now, I am talking about the Optum 360 coding books. If you're using a different edition, different brand of book, I don't know about any other brands. I trust Optum 360. This is not an ad, but I'm just saying, even though I sound like one. I trust Optum 360 because I really like their books. They're very thorough. They've got a lot of really good illustrations in them. And I also use a CPT Professional Edition by the AMA. Now that has another set of really good appendixes in the back. It's got a lot of really good examples there. It's got your pharmacology back there. It's got E&M examples of the levels and things like that. So the information that is in the book is already there. So I really recommend that if you're trying to write a bunch of stuff in your book, be very cautious about doing that because you can have your books called into question when you go to take your exam for excessive writing. So this is a big thing to watch out for, guys. Don't excessively write in your book because the answers are already there. Just review the book and make sure you know where to find things, because seeing a lot of writing on top of all the words that is already in the book is anxiety inducing. Guys, don't do that to yourself, okay? And take it from me. I'm somebody that loves and respects books. That's why I don't really like to write in them, okay? I've always been like that since I was a kid. I never like to write in my books. Even if it's like a workbook, I will still use like a separate notebook to write my answers so that I never write in my books. I've always been this way. Just my advice. Next question. I find your information to be very helpful. Thank you. I am planning on to start the CPC 2020 class online. Thanks for your encouraging messages. I would like to know what books I need to prepare for the exam and where to get them. Do you think there are used medical coding books for 2020? All right, here's the deal. When I see a comment like this, I want to say, pump the brakes, okay? You need to learn the basic building blocks before you even start looking at an exam prep book, okay? You still need to learn medical terminology, anatomy, physiology, and pharmacology. Get those building blocks done first before you even start thinking about all this other stuff about the exam and about finding a job. Don't worry about all that other stuff. That the time for that will come before you know it, okay? Concentrate on learning the building blocks first. Then you're going to learn about HIPAA. Then you're going to learn about medical ethics and law. Then you're going to learn about medical billing. Then you're going to learn about the guidelines and how to code and on and on and on. And then you can prepare for the test because there's no telling when this person is going to take their exam. Could it be this year or could it be next year? So why would you buy a certification exam prep book for this year when you're planning to take it next year? So that's the thing. You really do have to take things one step at a time. Don't try to rush. And that's another thing that I notice that a lot of people are trying to do is they're trying to rush out of school. I want to hurry up and get done so that I can hurry up and get in the field. Well, guess what happens when you get out in the field? When you get in the field and you start having to sit there and you have to code, they're going to expect you to know how to code, guys. That's why they give you a test before you begin your employment. because they want to see what you know. If you don't know what you're doing and you just passed your test and that's it, but you have no clue how to code, you're in trouble. And this is going to make it even harder for you to find a job. So take your time, guys. Go through it one step at a time. Trust me, this investment time right now that you're spending to learn all of this stuff is going to pay dividends when you get on the outside and you have to start applying for jobs, because then you're going to know what you're doing. Because a lot of times, like these really shady places that try to do these really quick courses will say, oh, you'll learn from your employer. The employer will train you. Well, that's not always the case. And like 98% of the time, they're going to expect you to already know how to code. So don't depend on your employer to train you how to code. They're going to train you for like how to use their electronic health record and like how to use the encoder and maybe some of their processes. But the fundamental basics of how to code, you are going to have to know yourself. I'm just saying. So, and with that, I'm going to tell you guys a little story. So I'm going to throw it back to my favorite movie as a kid. And yes, I'm going to date myself here a little bit. My favorite movie as a kid was the original Karate Kid movie, right? The one with Ralph Macchio and Pat Morita, right? So this Karate Kid, he wants to know like how to do karate and things like that. So Pat Morita agrees. Mr. Miyagi, he agrees. He's like, okay, I'll train you. I train you. Okay. So he says that he wants him to work on his fence first. He starts having him do like these little chores, little tasks. And he says, wax on, wax off. That's how you're going to work on the fence. Wax on, wax off. And so, you know, the Karate Kid's playing sport. You know, he's playing it. He's being a good sport about it. He's like, okay, I'll do it. And then in part of the scene, he says, why am I doing this? Why do I have to do wax on, wax off? You know, you're just basically having me do this labor for you. And so then Pat Morita does his little quick hands at him. Well, then he starts being able to block, right? Because he learned how to do wax on, wax off. It's the same idea, guys. You got to learn the building blocks first. And while you may think that this is mundane and yeah, you can be dismissive of it, you really do have to learn it, because understanding that medical terminology, anatomy, and physiology is going to make what you read better for you to comprehend. That's all I'm saying. Next question. How many coders work together in an outpatient facility such as a doctor's office? Not supervisors or auditors, just the coders. It depends on the facility size. It depends on if they have a lot of people like in the area, or if there's a big department that they have to work in. When I first started at this facility, there was 50 of us. Now we're down to 35 because people just move away or retire or whatever the case may be. So in the hospital that I go to for my own personal care, they have 2 coders. So, and it's a pretty good size facility. It's not a large facility, but it is a pretty good size. And all they have is 2 coders. So it really all depends on where you're working and who you're working for. Okay. Next question. Will a new coder in an office have other coders working together on a patient's medical record? No. Okay, so here's the thing when it comes to working on a patient record or a chart, okay? You are the only person that is going to be touching that record, period. It is not a group effort, okay? It's one name that is going to be on the coder, for the coder's name, for that record. It's only one person, okay? It's not a group effort. So, yes, that is the ins and outs of it. You may have the same provider, like you may work as a team with another person and you work for the same provider, right? And then you do one day on and then the next day you have off and the other person takes the next day. So maybe sometimes it's like that. It just depends. But if you are working on a record, it is only your name on that record. Okay. So next question. Do outpatient facilities, doctor's offices, offer volunteer positions for new coders? Are they open to training or teaching a new coder on a volunteer basis? Or is that just something that they are willing to do because they are not willing to do because of patient confidentiality? So here's the thing, when it comes to volunteer positions, you may not find a lot of them. They are typically any kind of externship programs or any kind of volunteer work. It is usually reserved for the people who are in the college programs like the RHIA or the RHIT, because there's already like a system worked out with that. You can't have civilians going into the back in a medical records area just to do volunteer work, because they're not technically employees and they would have to pass a background check. So that is one thing that you have to consider. Sometimes you can get lucky and you can find a place that will maybe train you and give you a chance. But there is a lot of entry-level positions. If you've taken some time, or hope you'll take some time to look at my medical coding job listings reviewed playlist, and I talk about entry-level positions where they do have them. You just have to know how to look them up, and I've talked about it in that video, so be sure to check that out. But that is something to think about. They're not really keen on doing volunteer work because you're essentially around medical records and patient information. This is private, so that's my answer on that one. All right, next question. As a person that has a bachelor's degree, do I need to go back and get an associate's degree in health information? I am trying to find a way to start getting into medical coding that would be a better route for someone who already has a degree and the quicker route to go. So having a degree already, if it's not related to health information management, just a regular degree in something else, another subject, is not going to exempt you from the coursework that we all have to do, okay? So when it comes to getting trained and things like that, you can go through a certification course just like everyone else, and you can go that route. You don't have to necessarily get a associate's in health information management, the technician, the RHIT. You don't have to do that. That is technically for people who want to be like in a supervisory type of role. RHITs are generally like your supervisors. They are like leads. They can be auditors and things like that. So those are the people who do those kinds of things, okay? So if you just want to be a coder, you can go through a certification program and you can get like the CCS or the CCA or the CPC, okay? Next question. I have visible tattoos on my neck and knuckles. I also have a misdemeanor from 7 years ago that I am not proud of. I'm hoping to get your opinion if these will stop me from starting a career in medical coding. All right. When it comes to tattoos is not a big deal, okay, anymore. I mean, I guess it used to be before, but if you have neck tattoos, just do your best to cover it up with makeup, okay? If you have it on your knuckles, you can use a Band-Aid to cover those up. You can do that. When it comes to like misdemeanors and things like that, you do have to be honest when you are filling out your application. It doesn't necessarily mean anything that you did in your past is going to prevent you from getting a job. The thing that would prevent you from getting work, any kind of criminal history that's going to prevent you from getting work as a medical coder, is going to be something like identity theft or violent crimes. Those, when people are doing background checks, and they generally go back like 5 years, sometimes they go back 10 years, sometimes they go back 20 years, okay? It just depends on how far back they want to go on you. But if you have something in your past like that, like identity theft or violent crimes, this is absolutely not for you, because there is no way that they could allow that. This is people's private information. These are very sensitive documents, and so because of this, because of the nature of what we do, that would pretty much keep people from getting work. But if it is something else, just make sure that you're very honest about it. Make sure you tell them what happened, like if it's been completely adjudicated and things like that. So just make sure that you are honest, because they will find it, okay? Next question. Do you work in a room or like in a wing of a hospital, or do some coders work, for example, in a separate room or a smaller private practice or other clinic? And do insurance companies themselves hire coders? Of course, insurance companies need employees too. It depends on where you're working. When I first got here to where I'm at currently, I worked in a big room with 20 other women and 2 supervisors, and we were all in bullpens. This was not a fun time, okay? I hated it. I hated being in a room because sometimes people are just not respectful of other people's need to concentrate, and they just want to be loud and they want to just talk. And if you don't have somebody that is a strong supervisor to sort of get those people to say, hey, we got to get in line because we got a job to do, it just becomes chaos because no one wants to hurt anyone's feelings. And I'm not a stickler. I don't mind talking. However, when it is constant and it is all day, and it's just like, how is anybody supposed to get anything done? So that was the case when I first got here. Now I currently have my own office. I am embedded in the clinic. Thank goodness. But I'm embedded in the clinic. I have my own office now. There are some people who share offices, but it depends on where they are located at. It's going to be different everywhere you go. I mean, there's no way to really definitively say. The place I was at before I got here, I had my own office as well. So, I mean, again, it all depends on where you are. Sometimes they have space. Sometimes it is just a cubicle that you have. And sometimes you're just in a room with a bunch of other coders. So it really all depends. But when I first got here, we were all in a room together because there was no space for us in the old hospital. When they built the new hospital, they were like, okay, we want space for the coders to be embedded in the clinics, which I think is a better thing because you need to have your coders on hand. At least that's my point of view. Some people might disagree and say that they don't want to deal with providers, but I think if you have that idea and if you have the attitude of that you don't want to deal with providers, you're missing out. You're missing out, and that provider is missing out. And I don't really care if they yell at me. They have yelled at me before, it's something that you get used to. But at the same time, they get a little gruff like that. Sometimes providers do because they've had bad experiences before. And I try to think about it like that. They've had a bad experience before. They weren't shown a proper coder and what a really good coder should be. So this is why I always try to be a good example. Not saying that that always happens, guys. I'm just saying. But that's how I'd like to think about it. So that I can show them what a good example of a good medical coder is. And so, and because of this, I've managed to turn around the attitudes of a lot of providers. So, you know, and it's better. It works out better for the patients. It works out better for the documentation, the facility, and on and on and on. So, you know, that's just my answer on that one. I know I went a little off on that one, but hey. All right, next question. I have 2 babies, a 3-year-old and a 10-month-old. My friend knows that I have been thinking of taking a course and brought this to my attention, not knowing anything about coding. We are both CNAs. I found your channel. So as a CNA, we work crazy hours on the weekends, holidays, and all of it. So my question is this a job that I can come home to my babies and have that family time? Of course, because we are typically Monday through Friday. Okay, we have the holidays off most times, and if you don't have a holiday off, it's usually they will give you an option of if you want to work on that holiday, if it's not a required holiday to be off. Okay, there is also that we don't do work on the weekends. Okay, typically we don't. However, it does depend on where you are. The place that I was at before I got here, we had a really weird schedule set up. They said, okay, you can work 4 10-hour days. And they said, if you want to work, we would like to have a 7-day coverage for the hospital. So we would like coders to be here, you know, at least one coder to be here every day of the week. So they said, if you want to come in on a Sunday, you can. So I was like, okay. I was all for that. So I worked Sunday, Monday, Tuesday, Wednesday. Yeah, and then I was off Thursday, Friday, and Saturday. And then I would just come in whatever time I wanted to on Sunday, because that was a benefit of me coming in on the weekend. Now, this doesn't always happen, okay? Sometimes wherever you are working, they want you to be on a schedule, okay? But at this particular facility, that was just a benefit of being able to work on the weekend. So if you wanted to do that, you could. And I really liked that. That was awesome. So, but I work Monday through Friday now, and I'm okay with it. My schedule's a little weird too. I work from 6 to 2:30, but that's okay because I get a whole hour before the clinic starts to, and I get to just have some quiet time and get everything going, and I'm not, getting into the frying pan at the last minute. So I like it. It just depends. That's a good question to ask when you are applying. What is the schedule like? If you've watched my job listing review, I talked about that too as well, because there was an employer that was saying we have these start times and you finish at this time. If you can't work these hours, please don't apply. And there was like a lot of really good variety. So you could start later or you could start earlier, depending. So that way you can get off earlier or you can get off later. It really all, depends on you. But that's a good question to ask when you are applying. And the last question is, can medical coders work part-time? If you are brand new, no. If you have experience, yes. They usually have like PRN or as needed coders that you can work part-time. The reason that new coders don't typically get, I have never seen one for a new coder, for a part-time new coder, because they know they need to train you, right? And so they're not going to invest time in somebody that they're only going to get a little bit of production out of. If you are getting hired as a part-time employee, it is because you've already had experience, you know what you're doing. They don't have to sit there and train you, and you're good to go. So if you're looking to get into medical coding and you kind of want to do a little bit of just kind of get in just a little bit, no, you need to be all in, okay? This is an investment, all right? And it will pay off. You just have to be willing to invest yourself, your time, your energy into it. And that is the thing about medical coding. You have to do that. It is not something that you're going to learn overnight. It's not something that you're going to learn, quickly. It is something that takes time to build. I am 10 plus years in and I'm still learning. So if I'm still learning, and I read quite often and I read quite a bit, so that is one of those things that you have to know when you're getting into this field. The learning never stops and it just gets better. So at least that's my opinion. Anyway, I'm going to go ahead and close this one up. So I hope you all enjoyed this one. If you have any questions, please be sure to submit them throughout the week and I will tack them on to next week's Q&A Tuesday. And of course, it premieres every Tuesday night at 7:30 p.m. Central Standard Time. All right, I'm going to go ahead and close this one up. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.